There's a silent epidemic sweeping through our nation that claims an average of more than 100 young lives each week. It knows no social, racial, or economic barriers. This silent epidemic is youth suicide. Suicide among youth recently has received a significant amount of attention in the United States, but concerns are long-standing. Every 12 minutes, a teen succeeds in taking their own life. So, what is suicide? Suicide is self-induced death, intentionally caused. Historically, suicide rates have fluctuated in the United States. In the 1930s, a time of economic instability, the rate was high. During the 1940s, rates declined. From 50s to 80s, rates again increased, coincide with the post-adolescent of the baby boomer generation. From 1990 to 2004, overall suicide decrease could in part be related to an increased use of antidepressant medication during the past 10 to 15 years. It is important to note that the childhood suicide rate, the rate among those 5 to 14 years of age, has also increased over the past 30 years. According to the World Health Organization, among the adolescents and young adults committing suicide each year in the United States, approximately 90% have some sort of mental illness, with depression constituting the majority of the diagnosis. And according to the American Foundation for Suicide Prevention, 44,000 Americans die by suicide each year. That's the equivalent of one suicide every 12 minutes. In addition, for each suicide, there are 25 more attempts. That means there are over 1 million suicide attempts, not plans, but actual attempts in the United States in just 1 year. The Centers for Disease Control and Prevention suggests that there has been an increase in annual suicide rates since 2006. Although there's no stereotypical quote-unquote suicidal type young person, the statistics on youth suicide indicate some groups are at higher risk for suicide than others. Suicide knows no boundaries. It occurs across all age, economic, social, and ethnic boundaries. Females attempt suicide more than 3 times as often as males. However, males die in suicide more than 4 times as often as females. In the age 10 to 24 group, 81% of the suicide deaths were males and 19% were females. According to the most recent national data from the Center for Disease Control and Prevention 2014, suicide is the second cause of death for individuals aged 10 to 24 years. It is the second leading cause of death for college-age youth in ages 12 through 18. It has also been reported that more teenagers and young adults die from suicide than from cancer, heart disease, AIDS, birth defects, stroke, pneumonia, influenza, and chronic lung disease all together. Moreover, each day in our nation, there are an average of over 5,240 attempts by young people grades 7 through 12. And with that, 4 out of 5 teens who attempt suicide have given clear warning signs. This means that if we learn the signs and know how to respond, we have an opportunity to assist 80% of those teens who are contemplating suicide. What are some causes of youth suicide? Suicide does not just happen. Studies show that at least 90% of teens who kill themselves have some type of mental health problems, such as depression, anxiety, drug or alcohol abuse, or a behavior problem. They may also have problems at school or with friends or family, or a combination of these things. Some teens may have been victims of sexual or physical abuse. Others may be struggling with issues related to sexual identity. Usually, they have had problems for some time. Most teens do not spend a long time planning to kill themselves. They may have thought about it or tried it in the past, but only decide to do it if an event that produces feelings of failure, suffering a loss, getting in trouble, having an argument, breaking up with a partner, or receiving a bad grade on the test. Most teens who kill themselves have a mood disorder. That's bipolar disorder or depression. A mood disorder is an illness of the brain. A mood disorder can come on suddenly and can be present on and off for most of a teen's life. A teen with a mood disorder may be in one mood for weeks or months, or may flip rapidly from one feeling to another. They may also lack firm values or rules on which to base life decisions. What are the symptoms of depression in teenagers? What do we know about young people who try to kill themselves or who actually die by suicide? Let's take a look at the warning signs and risk factors. Here are some key warning signs. Change in eating and sleeping habits. Withdrawal from family and friends. Statement of hopelessness, helplessness, and worthlessness. Stating comments like, "I won't be a problem for you much longer and nothing matters anymore." Violent actions, rebellion, running away from home. Drug and alcohol abuse, neglect of personal appearance, not tolerating praise or reward. Withdrawal from usual pleasurable activities. Key suicide risk factors include a recent or serious loss. This might include the death of a family member, a friend, or a pet. The separation of or a divorce of parents, or a breakup with a boyfriend or a girlfriend can also be felt as a profound loss, along with a parent losing a job or a family losing their home. A family history of suicide is something that can be really significant and concerning, as is a history of domestic violence. Child abuse or neglect. Lack of social support. A child who doesn't feel support from a significant adult in her life, as well as her friend, can become so isolated that suicide seems to present the only way out of her problem. Bullying. We know that being a victim of bullying is a risk factor, but there's also some evidence that kids who are bullies may be at risk for suicidal behavior. Access to lethal means such as firearms and pills. Struggling with sexual orientation in an environment that is not respectful or accepting of that orientation. The issue is not whether the child is gay or lesbian, but whether he or she is struggling to come out of an unsupportive environment. Prior suicide attempts increase risk for another suicide attempts. Cultural and religious beliefs that suicide is a noble way to resolve a personal dilemma. Although females make more attempts at suicide, males are much more successful in completing suicide. This is partly because males typically choose more lethal methods such as firearms, hanging, and motor vehicles. Females tend to choose medication or drug overdosing and cutting. Overall, less lethal methods. Data published in 2004 showed firearms were involved in 49% of completed suicide among individuals aged 10 to 19 years, hanging 38%, and poisoning 7%. Most research reviewing suicide attempts versus completion has demonstrated there are between 40 to 60 attempts for every completion. We all feel overwhelmed by difficult emotions or situations sometimes. If you are seriously depressed, having suicidal thoughts are a real concern. Here are warning signs and ways to get help. Get help when you feel trapped or you worry all the time. Get help when your feelings affect your sleep, eating habits, or school. If your friends and family express concern about you, you need to think about getting help. Get help when you are becoming involved with alcohol and drugs. And please get help when you are becoming increasingly aggressive, violent, or reckless. Remember this acronym, CLUES, to help someone suffering emotionally. C stands for connect. Make eye contact. L is for listening. Active listening skills. U for understanding. Empathize with their feelings. E is for express concern. Say that you care and stay with the person. And S, seek their help. Encourage the person to talk to an adult, and you tell an adult yourself. Nursing intervention. Nurses need to be aware of the growing trend of adolescent suicide and gain knowledge to prevent it. What are the warning signs we should look out for? How does this impact nursing? 80% visit a healthcare professional before they attempt suicide. What are we as nurses doing wrong? What are we missing in our assessment for this to occur? Suicidal ideation is often overlooked because nurses feel uncomfortable asking the tough questions. Nursing interventions involve showing empathy, knowing the risk factors and warning signs for adolescent suicide, asking direct questions about suicidal thoughts when you recognize warning signs, obtaining a thorough health and family assessment, providing your patient and their family with resources for treatment and/or community support. Call the 800 suicide number to get help. By knowing the warning signs and having a better understanding about interventions and resources, we can help our patients at risk of suicide. Sometimes it just takes one person to ask the right question to help someone in need, and that person can be you. Test your knowledge. Which of the following would you say is the most likely to commit suicide? A straight A student? A student who is gifted in athletics? A student who is abusing drugs and failing in school? A student who is very popular? Or all of the above? The answer is, under the right or wrong circumstances, all of the above could commit suicide. Thank you for viewing.